people can't recover if they're dead. And that's really what we're facing on the front lines. And it's absolutely horrific.
ALYSSA Miller works directly with people struggling with addiction. She and several others in her field say the Alberta government's approach in fighting the opioid poisoning crisis is not sufficient, as the province is on track for its deadliest year. Advocates are calling for radical action now, but several groups are calling out a tool in the government's fight, an app called the Drug Overdose Response System. They say it's extremely ineffective.
Many of them don't have access to apps or even a cell phone. So for them, it's completely ineffective.
The app works as an oversight while people take drugs. It has a timer that counts down and can be extended, but if it runs out, emergency services are alerted. But Miller says the app leaves out many who live precariously.
70% of overdoses are actually occurring not in the downtown area, but actually, outside of the downtown area and more so the suburbs.
According to the surveillance data, it's closer to 53 to 56% right now, which means we're leaving out a large population of people who are requiring medical assistance.
And involving a government system or even a health professional can cause concern.
Concerns about being arrested or they've experienced previous trauma.
2 police officers and 2 paramedics standing by my bed, just staring at me.
OPHELIA CARA is a rare safe supply user in Alberta. She says following an overdose, an experience involving paramedics and police has left her fearful of involving them ever again. After receiving naloxone, they tried to take her to the hospital.
And I said, I don't really want to. I've had a lot of bad experiences. The police officers grabbed me by my arm really roughly. I had a bruise for about a week after from how roughly they grabbed me. They pulled me to my feet. And I said, okay, fine, I'll go. Fine, I'll cooperate, fine. I just wanted them to let me go. I guess that wasn't good enough because then they slammed me down onto my bed face first, handcuffed me, and then gave me a shot of benzos so that I couldn't even walk properly. They kind of half pushed, half dragged me down the stairs in front of all the neighbors. I didn't even feel human.
Some advocates say the app and recovery spaces are useful in the deadly battle, but forgotten are those still living in full addiction, and more harm reduction support is needed.
Just trying to keep people alive right now due to an increasingly toxic supply on the street.
In Calgary, Taylor Broad, City News.